This video is about cervical spondylosis. Now, doctors had to make themselves sound smart, so we invented this language that takes about 4 years to learn what you're talking about. But in essence, what cervical spondylosis means is that the joints or the vertebrae are coming closer together, and it's kind of like the Tin Man on the Wizard of Oz. You're running out of oil, and when those membranes around each bone touch, they can really hurt and cause nerve compression, and we call that cervical spondylosis. So maybe a better way to describe cervical spondylosis, it's an age-related wore-out shock absorber. So what are the causes of cervical spondylosis? It develops from a wear and tear of the cartilage in the bones found in your cervical spine, which is in your neck, and while it's largely due to age, it can be aggravated or caused by other factors as well. According to the Mayo Clinic, the condition is present in more than 85% of people over 60, although some people who have it never experience symptoms while others experience severe symptoms. For some, it can cause chronic pain, severe pain and stiffness, and many people who have it are able to conduct normal daily activities, and most don't know about it unless they take an x-ray. So what are some natural ways to treat cervical spondylosis? One is to work on the muscles through massage therapy, through stretching, through manipulation therapy, through chiropractic, through physical therapy and rehab. And then there's some regenerative injection therapy considerations, some pain management therapy, and then the last resort is surgical intervention. So what can you do to help increase the space between the vertebrae so that they don't have that worn out shock absorber? So one of my favorite things to do is to get people on an anti-inflammatory diet. You really got to watch white sugar and you got to watch white flour. There's some neat things that you can do as far as joint therapy, like liquid joint revive from Nature's Annex or collagen therapy. I really think the mineral manganese is essential for strong ligament health, and also some traction. Traction's really good, and a pillow that is helpful for you at night that puts a little arch in your neck is tremendously effective for cervical spondylosis. I have found that consistent chiropractic treatments, usually in that 1 to 2 month range when you're not in an acute condition, are really helpful as far as prevention. And then if you're in an acute flare-up, chiropractic therapy as needed is really effective. I've seen really good outcomes with acupuncture, where you're balancing the different energies, the meridian systems that are running up through the spine, not only on the back and the front, and then the neural therapy when you can reprogram the nerves, where you take a little syringe, a little tiny needle, and you do these superficial injections with procaine over the neck. They look like little mosquito bites. It really helps the nerves to open and to close and to reset. And although it's not specifically putting increased space in between the vertebrae, neural therapy is very effective for the management of pain without having to use a muscle relaxer or an opiate therapy or a real strong pain reliever. So cervical spondylosis, again, when the vertebrae come closer together, most people have it over age 65. The best way to really evaluate that outside of clinical symptoms or what it feels like is to get an x-ray, and then if we're worried about the disc, you can get an MRI. The course of last resort is the surgical intervention. And then also there's some really neat regenerative injection therapy or RIT therapy. And that can be neural therapy, that can be prolotherapy, it can be neural prolotherapy, it can be prolozone therapy. But essentially what you're doing is you're taking vitamins and minerals and you're injecting the structures of the neck. Sometimes you accompany that with oxidative medicine, and then your natural pain reliever therapies that we've covered in previous videos with arnica, with golden seal, with curcumin, with turmeric, are all effective treatments for spondylosis. It's really a lifestyle management condition that frequently gets mismanaged by giving people happy pills or antidepressants and muscle relaxers. I think the natural solutions of massage, of chiropractic therapy, of regenerative injection therapy, and oral therapy are effective solutions for the long treatment of cervical spondylosis.